Great. Thanks, Natalie. So, welcome everybody. I'm excited to be here today, and please keep it coming in the chat. Let me know who you are, what you're hoping to get out today. I think it's really hard at a recreation conference to be online and to not have any opportunity to engage in person. I feel like when it comes to play, it's a serious business, but it's also a very fun business. And so, my hope is to engage y'all today with the chat and to have some conversation together about why we're here. So a little bit about me, because I'm asking you about who you are. My name is Jenn Beideman. I'm the advocacy manager at Common Ground Health. We are a regional health planning organization that serves the 9-county Finger Lakes region. We are located in Rochester. Today, I am hoping to learn more from all of you of how health can continue to support recreation and vice versa. And we'll talk a little bit more about that as we dive deeper into building partnerships for play. My favorite way to play lately has honestly been trying to get outside as much as I can before the winter comes. And I'm currently trying to explore buying some snowshoes because I can't imagine what this winter is going to look like. So today we'll go into a little bit about what's going on in Rochester when it comes to unstructured play, the work that we've done alongside residents to really push forward some significant changes to the landscape. And then I want to talk a little bit about how this model can be replicated and where we've been able to partner, where we've been able to leverage resources, and what the key drivers have been for us locally. So a little bit about Healthy Kids. So I told you that I was with Common Ground Health and that we are a regional health planning organization, but we have a very robust kids initiative called Healthy Kids. We are a grassroots community coalition that serves the 9-county Finger Lakes region. We have been around since 2008, and we bring together more than 65 community advocates, from residents to the faith community to nonprofits and the academic community as well. And really our focus is to advance policy systems and environmental change. So we're really looking at the system-wide approach to kids. Our coalition focuses on whole child health. And when I say that, we mean that it really does take a village to put kids first. And we recognize the importance of relationships. And we know that so often what is great and good for kids' health and youth development is often siloed. And so many of our whole advocacy agenda really revolves around the fact that we can't silo a child, that we really need to look at their physical, social, emotional, and cognitive development and solutions that advance all three. So we also, as a coalition, recognize the impact that systemic racism and toxic stress have on our littlest kiddos. And so all of our focus for our coalition is kids 0 to 8. And we really push forward equitable solutions and equitable outcomes for kiddos, because every child deserves to have an equitable opportunity to a long and healthy life. Our advocacy agenda is really based on these 4 pillars. And like I said, I'm happy, reach out to me at any time if you want to learn more about some of the other ones. Obviously, for today, we're going to focus on the power of play. I don't need to tell a room full of recreation professionals about the importance of play. We know it is fundamental to how kids learn, grow, and build relationships in their life. And so our portfolio around the power of play is really what I'm going to be talking about today. And I'm going to start that with talking about a little bit about what the state of play is. And I'm going to ask you to start engaging in the chat with me a little bit, because I want to know, what are some of the barriers to unstructured play in your community? So let's start there. And if folks want to unmute themselves and just talk, that's okay too. You know, I'm hoping to get a better understanding from y'all over what you're seeing locally. You can also think on it while I move forward. But I want you to think about in the chat, you know, what are some barriers you see as recreational professionals to unstructured play? You know, unstructured play is something that we've seen across the country disappear from kids' lives. And we know that that is fundamentally important to how, like I said, they learn. It is essential to their physical, social, emotional, and cognitive development. And more importantly, you're just letting kids be kids. So think about this question, share in the chat your thoughts as I go through to share with you a little bit about what's happening in Rochester and how we've worked to identify some of these barriers. So a little bit about Rochester for folks who might not know a lot about our city. Poverty obviously has been growing in the city of Rochester since 1970. And, you know, we see in this map here that, you know, poverty is highly concentrated within traditionally segregated communities in our city. And so what we do know is that these predominantly Black and Brown and Latinx communities that have concentrated poverty also, from our data, shows that that residents are 3 times more likely, Black and Latinx residents are 3 times more likely to live in poverty than their white counterparts in our county. We also know from our data and looking at years of potential life lost that structural racism and historic factors that have promoted segregation in our country and propagated racism in our country are actually killing Black and Brown residents across the Finger Lakes region at a highly disparate rate than their white counterparts. And so we know that whatever solutions we push forward as an organization, that we need to address structural racism and the toxic effects that it has on communities of color. So these disparities play out in our barriers to play. And so a couple of years ago, Common Ground Health created a 9-county survey, which basically asked folks about their health. It was called My Health Story. And, you know, this here was one of the questions we asked folks. We had 7,000 respondents over the 9-county region. And we asked them, you know, what is your neighborhood, good or great to be outdoors? And what we found here is the teal color on the right is perceptions in the suburbs surrounding the city of Rochester. The blue on the left, you'll see, is the self-reported state of neighborhoods from City of Rochester respondents. And obviously you can see the disparity there, that, you know, folks in the city of Rochester are not saying that their neighborhood is great for kids to play outdoors. And for us, that's a problem, right? What we've also done here at Common Ground Health is we have conducted playability studies. So this is work where we've worked alongside residents in neighborhoods to do a quantitative assessment with the BRAT-DO tool, and really had residents identify common barriers to play space and then do the assessment. We paired that quantitative assessment with focus groups and really finding kitchen table conversations with residents to be enlightening to the quantitative data. What we found in that work is that traffic safety, neighborhood safety, and the state of our parks and playgrounds are really the top barriers to play in the city of Rochester, and that they deter parents from letting their kids play outside. What we also know now from doing that initial assessment is that kids aren't actually playing in parks and playgrounds. They are, we have some data that shows that 82% of kids are playing outside of parks and playgrounds. They are playing on the street, in vacant lots, at community organizations, and when I talk to recreation folks, they're like, wait, what? Why aren't people using parks? And I always tell folks that, you know, think about how, you know, we used to play. I used to be on my bike from the minute that breakfast was done till mom called me in for lunch, until mom called me in for dinner, until it got dark. And so, it's not surprising to us that we see 82% of kids not playing in parks and playgrounds. And so the question becomes then, parks and playgrounds are essential and important, and they serve a need in our community that's essential. But how do we start transforming the spaces that kids already are? And how are we promoting policies and systems and structures that support safety for kids to improve perceptions of them being able to play outside in their neighborhood? So what do you do when you find out all this data, right? We actually, since 2010, have been working in this space around play. And 5 years ago, launched a campaign called Play Rocks. Rocks is in Rochester because everything is rocks here for folks outside the city. And really, this is the vision for the campaign, to say that every child has a safe and accessible place to play in their neighborhood and at school. And when we say safe, we mean we're addressing barriers of traffic safety and neighborhood safety. And when we say accessible, we mean that every child has access to a space that is developmentally appropriate and fun for them, that regardless of race, gender, ability, they have a place where they can go to reap the benefits of play, unstructured play, in their community. So who leads the Play Rocks campaign? It is our Play Rocks Advocacy Committee is a 32-member committee. It is predominantly driven by residents, caregivers, and caregivers in the city of Rochester. So we have moms, village aunties, uncles, really folks who are just passionate about the message of play and improving their neighborhood and ensuring that kids in the city have equitable opportunities. We pair those residents with community partners who are also passionate about play and know the benefits of play. So the City of Rochester's Department of Recreation and Human Services is a member, alongside folks in the accessibility community as well. And so we really pair what we call context experts, which are the residents who know their neighborhood better than anybody, with content experts who are the professionals in that space. So as you're thinking about barriers, I want you to also start thinking about and telling me how do you support unstructured play in your community? What are you seeing that is working when it comes to unstructured play? Is it, if it is at all? I want you to think about some of the ways that you're currently promoting unstructured play, but what would you want to do in the future? But we'll get to that. So let's talk a little bit about the campaign successes. So our campaign started with this idea 5 years ago that we would really change the conversation around play, that we would bring back the power of play to the city of Rochester. And, I would say that our whole team at Healthy Kids did not expect the successes that I'm going to share with you right now. And we didn't anticipate the movement that it has grown. I will say that one of our first things that we did was to start thinking about what our policy agenda was, of what systems we wanted to change, what advocacy we wanted to do, but also paralleled a communications campaign that said, we can our public spaces for play, and let's do it. And so we've done a number of things that I'm going to share with you. So the first was, we looked at policy, right? And so more often than not, there are barriers for families to just get out and play. It's not how it was before, back in the 90s, early 90s and the 80s, right? So, the culture has changed. And so how are we supporting a government structure and policies that promote a playful environment? And so we've done advocacy to support the development of a play streets policy here in Rochester. We have been working the city to develop policies that transform environments in creative ways. And so the city of Rochester is one of the only places in the country with a playful sidewalk policy, which means that residents can reclaim their public space in creative ways that promote unstructured play. So when I talked about earlier activating spaces outside of traditional parks and playgrounds, we really want to promote this idea that play can happen in everyday space and that we can transform our neighborhoods and our environments to prioritize kids and families and to prioritize play. And what I mean by that is imagining things like hopscotch on a child's walk between their library and recreation center. Just a moment of fun, of opportunity. It's things like story walks, which allow you to read a page of a story as you walk along a trail or from one destination to another. It could be as out there as a swing at a bus stop. I've seen other communities do it. But there's really, ways that we can transform public space to promote the benefits of play and to promote, honestly, physical activity and relationship building. One of our biggest wins has been actually embedding play and kids into the city's comprehensive plan. So a comprehensive plan is the guiding document for cities. It really sets the stage for future policy change, for future programming. And we saw this as a huge opportunity to really prioritize kids. And so what you'll see here, I'm not going through each line with y'all, but you can see here that in 1999, in the initial plan, play was mentioned twice, and in Rochester 2034, the new comprehensive plan that's been adopted, it's mentioned 55. Kids and youth are actually mentioned more than 6 times, right? And so all of these things set the stage of the landscape of the priorities for our city government until 2034, which is pretty fundamental. We've also, as a committee, started thinking about, what place looks like and how place can be transformative. And so we've done a lot of pop-up opportunities, temporary installations, created really fun ways to reimagine space. And so I'm going to go through a couple of pictures because pictures say it better than me describing them all. We've created an interactive corridor downtown, which is called the Playwalk. It connects our library to MLK Park here, which is where you'll find the musical instruments. It has musical elements, foosball, a giant Connect 4, and really the hope is that folks can play along the way, promote connectivity. Right next to this park is the National Museum of Play, and so really trying to promote this idea that, a walk doesn't have to just be a walk. We've also created story walks at libraries. So, like I said before, this is a way for folks to read a book along the way, and really transform space in a tangible way. This is a story walk that we created at schools, at a school recreation and library hub in one of the city's neighborhoods. We've supported tactical urbanism, and so that's a really wonky way of saying temporary installation in public space. And so when we think about barriers to traffic safety, we try new things and we test things out. And this installation actually is in our Beechwood neighborhood here in the city. And they were having a huge problem with speeding cars along the street. Folks were going, they had an average speed of 46 miles per hour on a 30-mile-per-hour street. And in adding this installation and getting some curb bump outs, which you'll see are the orange pillars, it showed to tangibly reduce speed by, oh, I'm blanking. I think the average went down to like 36 miles per hour. So we saw a tangible decrease. And this is a really important hub for the community. Across the street is a convenience store. It's also where the community hosts play streets. So right next to the convenience store, they have a number of playful sidewalks and shut that street down in the summer for play streets. Across the street, there's a cafe as well as a community center. In terms of transforming systems, so, when we started this, we realized that we couldn't do all of this work alone, and none of the policy work or the placemaking work is actually successful without partners. And so, when I say to folks outside of recreation who are advocating for the health benefits of physical activity, I always say you can't do this without your recreation department. And so we have been working alongside our city rec for the last 5 years to really think about how you transform internal recreation systems to support unstructured play. Because as movement has grown for this, and as residents have continued to expand this work in reclaiming their streets, the cities recognize that they have to keep up with it too. And so City Rec has, is working on, is developing their Play Streets policy now. They have signed on and worked with the NRPA alongside us on the 10-minute walk to park national commitment. We have shared staff. So, when we have big projects that require collaboration between us, we share staff pretty regularly. And, that is not just them supporting us in a project. It is really, here is a team member at City Rec that's housed at City Rec that works on some of our priorities alongside residents and also works alongside City Rec on their priorities. And it really is founded in the shared commitment, right? And so we'll talk about this in a little bit about how to understand and who you can reach out to get that shared commitment to start transforming systems. The other piece that has been really important for the work in pushing this is the power of youth. And so recreation has this unique advantage of being connected to youth on a daily basis. And so in the city of Rochester, we have a mayor's youth advisory council. They have been part of this campaign from the very beginning, taking things on themselves, doing, creating public, oh my gosh, blanking, public service announcements and videos, really sharing it out, providing us with feedback data, surveys. They have been on it, and that has been really important to figuring out a way that we can engage youth that attend recreation centers and are part of recreation programming. We've also managed to establish some programs for play. And so I'm seeing in the chat, folks are saying that, we see a lot of scheduled activity. We see, we're not sure what programming looks like. And so there are ways as recreation professionals that you can be supporting unstructured play. And so we have a mobile recreation unit here in the city of Rochester that really does that. While they provide structured activity, they also just have a bunch of stuff on their truck and they bring it out. And while they do some structured games, a lot of it is just the kids hanging out and having a recreation official with them, somebody who has a background in youth development to support them. And it promotes this idea, it helps ease parental perceptions of safety when they know that there's an adult there alongside them. We talked about play streets again, and for those that might not know the concept, it's really exactly what it sounds like. It's shutting down a residential street This is something that's happening across the country, from not just us, but in New York City, Philadelphia, Seattle. There's a lot of comprehensive programs. The biggest thing I would say is, if you're looking to start play streets, is think about the cost associated with it, because we've been really pushing for play streets to be a free event, free of charge for the community, and whoever wants to host them on their street. We've done things like nature challenges, so thinking about activating parks in really unique ways, from trying toy lending libraries to really programming space, but allowing for unstructured pieces to happen when there is something that's programmed. And probably some of our biggest things are pop-up play days. So when I say that our work is co-created and that we work alongside residents, I do mean it. That while I am very much a white woman who is not from New York State, I am from Canada originally. This work wouldn't have happened and won't happen without residents on board and alongside with us. And so, we started this campaign with the communications blitz of doing all these random pop-up play days as staff. And so we recruited our coalition members. We recruited, the residents in the neighborhoods that said, like, yeah, let's do it. And one of our biggest events that we've managed to create over the last couple of years has been a citywide pop-up play day, where we provide technical assistance and resources to residents, whether they are with a neighborhood association, a church, a block club, or they're just a mom who wants to do something cool on their street. We provide technical assistance, some funding, some structure that, but basically say it's up to you. However you want to reclaim your neighborhood for play, go for it. And the first year we had a goal of getting 8 pop-up play days on the day in all 4 quadrants of our city. So our city's broken up into 4 quadrants. We ended up with 13 in the first year, and we thought that was amazing because, we're all about the power of play, and we were excited to see so many residents also excited about the power of play. Over the years, obviously this year we had to put it on pause, but last year when we did our Play Rocks Your Neighborhood citywide play day, we had over 43 sites across the city, all creating pop-up play days on the same day. So, when I say it's a resident-driven movement and it's grown, I mean it. These residents don't just participate in the day. They are part of all of these placemaking projects and changing their neighborhood for play. They have gone to council, they have met with their elected officials, and they have advocated for these successes. So I share all that to say, a lot is happening in Rochester around unstructured play. And, we have worked alongside residents and our partners to co-create and create what we're calling a culture of play, right? We've embedded them in their policies. We've embedded play into city systems. We are changing the way our neighborhoods look and the landscape looks. And so I want to now talk a little bit about how you do that, right? So if you're looking at all of the ways that Rochester has been successful, I want to bring the success to your community. And so I'm going to now start talking about resources, partnerships, the nitty gritty of the how-to. So talk a little bit with me in the chat about where you currently fund some of your programming. Where does it traditionally come from? And feel free to unmute yourself if you want. And you think about it and keep talking as I talk, because, like I said, I'm not a recreation official, right? I work at a public health organization. And so typically what we hear is that, traditionally, when it comes to, city programs, the city relies on their budget, and that's kind of it. That there's, they recognize that they can apply for some grants, but recreation doesn't always think about the additional connections that can be made, right? And so here's an example of all of the funders, our past and present, who have supported this work. We've had local funders support us. We've had national organizations fund us, from Kaboom to the National Recreation and Parks Association. We have had neighborhood associations fund us. So Cornhill is a neighborhood here. They've funded our project, one of our projects. We've had the city fund this work. We've funded this work. So New York State, through their Creating Healthy Schools and Communities program, has funded this work. And our local insurers have also funded this work. And so when you think about, recreation and the power of play, I would argue to y'all to think broadly about what that means, right? And so when you're looking for project partners, it's really a large opportunity to think about, who else would be on your side in this space. And, I know someone earlier was talking about the business community. Traditionally for us, that's been hard to tap, but it doesn't mean that there aren't businesses that are looking to support. We've had a lot of very localized business get interested in this work, from like salon and barbershops, saying like, this is really cool. How do I bring this to my clientele? How do I reclaim this? We've had, churches, the faith community reach out. We've had local Rotary clubs reach out and to say, how do we can support? And so I would say, don't get discouraged if you go to your big businesses and they're like, we don't have time for this. I would really urge you to think as local as you can, because we've had, coffee shops donate coffee for the day for play streets and things like that. So you just don't know. So I want you to start telling me a little bit about like who some of your current partners are in this work. It looks like a lot of people, it was donation based where you've been getting your funding. It's, OCFS and the state that's been funding the work, which is good. I think I'm going to try and make the case as this continues to go on about how you can actually work with health, and that there are partners in the health space that are primed to partner with you in this space as you're promoting play. So talk about a little bit who your partners are, and I will give some examples. So our biggest partners for play and to move this culture of play here in Rochester have been residents and youth. And so I've said that probably 3 times already, but I will reiterate that this is really of residents for residents. And so this is not Jenn from Common Ground Health saying this is the solution. It has been residents saying this is the problem. Jenn, help us. Like, what are things that we can do to solve that? And me presenting ideas and the residents deciding what they want to do. And when we think about that in the context of historic segregation and structural racism, it is incredibly important that we put the power back into the hands of Black and Brown residents. And so, I am here, like, my job is to have no job at the end of the day, because what I want to do is give residents the tools that they need to execute their vision in their neighborhood. And so don't work in a silo without residents in you and so with you alongside the process. And so if you're creating a new park or a new play space, think outside of the box of traditional methods of community engagement. Sometimes just hosting your charrette and your public information meeting isn't enough, right? You get a lot of the same people going there. Think outside of the box of ways that you can meet residents where they are to get the feedback that you need to be successful. Because when you do that, when you partner with caregivers, when you partner with youth, and they are the ones in the lead, moving a project along, you get ongoing commitment to that work, and ongoing support to that work. And so, when things go wrong, which sometimes that happens, right? Or something breaks or whatever, you already have a tangible group that is there to support you, to say, hey, city rec, this piece is broken on this park. I'm noticing that it's an issue. Can you help me out, right? Before the complaints start rolling in, right? Or, hey, I've noticed that, the paint is fading on our playful sidewalk and I want to do this again. I'm going to raise money to support this because I can go out to my neighbors and say, like, do you have $5 to give me because I want to go out, right? And repaint this sidewalk to have the hopscotch that was there. I don't know. I just like fundamental partners for us have been residents. And when residents drive the solution, when they create the solution, when they identify to you what the problem is, you will have much longer sustainability than if you come down to them and say, this is how it's going to be. The other places that I would recommend reaching out that have been really supportive of our work have been churches in the faith community. And so typically, this isn't folks that you might think of, but in Rochester, and particularly in neighborhoods of color, churches are like the centerpiece for Black and brown communities. And so if you can get churches on board to your cause, you have an automatically a way in to reach a number of folks. And so consider that when you're piloting programs or wanting to try something new in a neighborhood where you might not have the resident connection. I would also say, look at your local funding, your local funders and what's available to you. This work started back in 2010 with a national grant from Robert Wood Johnson Foundation. But the work of the campaign has been predominantly funded by our local health foundation. And so really dive a little bit deeper and spend some time. I know it's hard that recreation officials are strapped right now. Everybody is. And, I feel like when we think about the current landscape and the state having a $16 billion deficit and not knowing where the funding is going to come from for some of these services and programs for kids, it's more important than ever that as recreation officials, you start thinking outside of the box on where funding can come from and where support can come from, because it might not be from the state. And, we all know that recreation budgets get cut first. And so how can you partner with your local foundations, with local nonprofits, with the health sector, with residents and churches to push forward this work? The other pieces that I will say, and these are a little bit more traditional, is, think about your hospital systems too. And so, in working in the 9-county Finger Lakes region, each region is required to submit to the state their plan of how they plan to meet the New York State prevention agenda. And the New York State prevention agenda really has a strong focus on addressing chronic disease. So thinking about heart disease and COPD and all of that. You know what a great mechanism is to lowering chronic disease and promoting disease prevention? It's through physical activity and play. And so I would really, as you're thinking about projects that you want to do or systems you want to push forward, really connect with your hospital systems and see, what are they willing to do? Look to your local insurers. We have had funding from Excelis. We've had funding from MVP. These are folks that if you frame it in the right way, you don't know until you ask, right? We've also had strong partnerships with our local libraries. And so typically, because libraries are funded different than rec centers and recreation, and schools are funded differently than libraries and rec centers, we seem to think of each other as silos in this work. And so what I would urge you all to do as recreation officials is to flip your thinking of where are kids now? How do we support kids, right? So instead of thinking of it as place-centric, how are we flipping the conversation to say that this is about the health and wellness and well-being of our kids? And when we do that, we start to braid together resources in a very intentional way and in a way that is not siloing us from one another. And so we have been very successful in working with schools and libraries and city to braid resources, to braid really, work together in ways that wouldn't have happened otherwise. And so, if you're a rec center or you are working on a project and it has within a 10-minute walk from it a library or a school, I would recommend reaching out to the library and the school, and think about, how you can go to the library and school to get the feedback that you need, right? The other folks that we've partnered with, and this might be a surprise to some, but maybe not because you're recreation folks, is landscape architects. And so when we talk about our projects and we look at placemaking and changing space, we recognize very quickly that we weren't experts in that space. And so how do we bridge that knowledge that comes from landscape architects, that come from engineers, right, to support changes? And so think outside of the box with your partners. And I want to, as I've shared all that, I want you to share in the chat, who you're planning to reach out to now that I've shared a whole list of things. And I also intentionally put this question. So I want you to think about new partners that you might not have reached out to before. So share what you're thinking in the chat. And then I also want you to talk about how, if you're going to now, how you're going to partner with residents and youth. Is there a mechanism that you want to try out? And what challenges you think you might have. So the 3 questions were, who are you planning to reach out to? How are you going to partner with residents and youth? And what challenges do you think you're going to face? And I'm going to put them in maybe I can ask Natalie if you could type them in the chat for me as I go on.
I'm taking over for Natalie, but I can do that for sure.
Yeah. Oh, thanks, Esther. So I want to share some lessons learned, and then I want to turn it over to all of you to ask me questions or just to share your thoughts, feelings, and everything. But I feel like I would be remiss if I didn't wrap this up in a nice little package to say. So, we've talked about a lot over the last little bit and about the work that's happening here in Rochester. And, I want to reiterate that there are key drivers to change that have made this work so successful here. Again, I reiterate, resident engagement and activation from the very beginning has been so fundamental. Residents have identified what the problem is. They have worked alongside us and our city recreation department to quantify and qualify what those barriers are to play. They have driven the solutions, they have created those solutions, and they are moving that forward in their neighborhood. And so without them, this wouldn't have worked. It honestly wouldn't have. The second piece is coalition building. So really, like I said, think about who your partners are now and how you can expand upon them. A lot of folks recognize the importance of coalitions. They recognize the importance of coalitions, but we recognize that sometimes it takes a little bit longer to do the work when you have multiple partners. But when you spend the time, you bring the partners together, you address concerns, you build a solution together, you end up with a more sustainable long-term solution. Another key driver has been getting the support from the top. So when I say the top, I mean our elected officials, from our mayor. Our residents have been going and speaking to council, speaking to our mayor for 5 years now, to say how important this is for them. And because residents have done that work, we have very strong supporters in City Hall now that are partners with us in the team. The final thing is that this wouldn't also have been so successful without a citywide approach and without the advocacy that the residents have led. And so when we think about, you know, creating just a park, I want you to think about, how does this fit into a broader systems approach? And so how does this fit into your overarching recreation plan or strategic plan? You know, how are you ensuring that whatever you're piloting anywhere fits into a broader picture? Because that really helps bring folks outside of that one neighborhood or that one area along with you. I'd also say there's a lot of barriers. You know, we always say that, you know, it is time consuming. This has taken a lot of work. None of this happened overnight. We run into a lot of issues with liability of who wants to take on the liability for different projects, whether it's in public space or with doing things like pop-up play days. You know, and I don't, it's really case by case. But I feel like I need to share with you that there are barriers to the work. We've also noticed that sometimes when you're presenting new ideas, the lack of policies that support neighborhood play or unstructured play really become barriers. And so sometimes City Hall doesn't know what to do with us when we say we want to shut down a street for play, but it's not a block party. And so because sometimes City Hall can be very super rigid, you know, that becomes a way for us to grow and learn together, but can slow down the process. There are ups and downs in innovation. So when we think about, like, this takes time, it is not easy. We didn't start by doing those huge painted landscapes overnight. It started with me and my colleagues on a walk to school day, chalking a crosswalk and using chalk on a sidewalk to show what these concepts could mean 5 years ago. So it takes time. The other pieces are, obviously, you need to get that buy-in from multi-stakeholder partners. And so thinking, you know, that just takes time. Funding is always an issue. And so you need to think about, like I said earlier, the various funding sources you can draw from. And then the biggest barrier, I would say right now, when it comes to unstructured play, is really the lack of evaluation tools that allow us to evaluate play in those non-traditional spaces. And so, you know, while there might be a tool that assesses, a quantitative tool that may assess, you know, perceptions in a playground or perceptions in a park, or what's available in a park and playground, that doesn't necessarily translate to where kids are and where they're frequenting. And so if we know that kids aren't playing in Rochester in those spaces, how are we assessing the spaces where kids are? And how do we assess some of these new and innovative ways to transform public space? So this is really my lessons learned and our lessons learned as a team here at Healthy Kids. You know, I will drive home again that, you know, letting residents lead this work is critical. And so it's really important that you identify mechanisms for authentic community engagement and not just check the box because you've done, you know, that one community hearing about whatever you're planning to do. You really have to think about the ways that you include community members and youth in the decision-making process. So not only are you going to them and asking them what they want, but let them be part of narrowing down the solution and be the deciding factor of what happens in their neighborhood. Like I said, build your coalition, think outside the box, build your partnerships up, because none of us can do this work alone anymore. If we know anything, is that we really need to be thinking about this without our siloed approach of the past, and that as we move forward together, we're able to build more sustainable solutions. Identify your champions in local government. It didn't start with the mayor for us. It started with city staff. And it actually started not with our recreation department, but with our Department of Environmental Services. And so, you know, think outside of who else in city government is an ally to you in this work, because most often we have worked with recreation, Department of Environmental Services, our neighborhood and business development department to really move forward all of this work. And then the final thing that I would say is like patience. This didn't happen overnight. It's not going to transform automatically, but it does take time. And so, you know, give yourself grace as you move forward and try innovative things. And more often than not, you will, if you're working alongside residents and you're co-creating those solutions, you'll get to the end goal eventually. Or at least that's what I'm hoping, because we're not at our end goal either, right? Lots of barriers still exist, and we still keep plugging away and keep chipping away at the barriers. So this is my email and my phone number. You can contact me at any time, but I really want to spend the next 10 minutes hearing from all of you. Like, do folks have questions for me, thoughts, comments? I'd love to hear from you.
You can either type in the chat a question that you've got for Jen, or you could unmute yourself and ask questions if you'd like to that way. And Jen, if there were specific questions, I'm not sure if I missed it. I'm sorry if I did, but you wanted me to put in the chat. I can also put those in there.
Yeah, I think like if folks don't have questions about content, what I'm really interested, and maybe my question is for all of you, is knowing what we shared today, what are you interested in bringing to your community? How are you going to partner differently? Like who like if I gave you a task or a challenge of calling somebody up tomorrow to say to promote unstructured play, who would you want to reach out to?
If I can make a comment.
Yeah.
I really liked what you talked about with the residents. I feel like that's so overlooked, but they're the most invested and the most affected by an event maybe that you're going to put on, or a program that you're going to put on, and they can often be like the biggest hurdle to jump over. So if you start with getting them on board, then you've got such an ally in terms of getting support. And yeah, you're right, it's easier to fundraise if you've got residents on board. I really like that idea. I'm looking into doing some events in association with Greek Peak, and again, I'm teaching at SUNY Cortland, so it's a little bit different than other types of programs. But getting the people who live in that area involved is something I don't think that's ever been done before. So now I'm like trying to think of that as maybe a way to find volunteers, and also to make it relevant to the people who live there instead of the wealthy from the city that are coming up as well. So it's a really good point. I really thought that was extremely relevant. There's another question coming in from Hannah Brown. I don't know if you saw that.
I did. Hannah, we can help you. And knowing that you're a city resident too, there's a process for it. It's free. So you'd have to work alongside your neighborhood association or block club. But I'm happy, like, please reach out to me, because I can share with you what the process is and how you can get it going. But the city provides the paint, so it's really up to you to do the design and recruit your neighbors to support.
That playful sidewalk thing also really makes me think of like murals and how that's kind of become a much more common thing we see in communities. Like Cortland used to have none, and now they have lots. And I live in Ithaca, where they're kind of everywhere and also going up, always going up. I feel like there's an element of that there as well, that it makes it fun. Like there's certain stairways that my kids love going up and down because they have like what are they called? Space people? I can't think of the name. Astronauts, like going up and down them. But I feel like there's a lot of different angles you could take with that playful sidewalk idea in terms of adding art, playful art to communities. I think there's a lot of different angles you can go with that. I like that idea a lot.
Yeah, and a lot of the murals, you know, they can build a sense of community and transform public space in a very unique way. And so as recreation folks, how are we taking that concept and building something that makes it active, right? Or gets people to use stairs, or, you know, think about things just a little bit differently. Because when you transform a public space in such creative ways, you know, people want to go and see it. And they want to try it out. I have a question here for suggestions for a rural community. And so while my presentation is mostly focused on work on the city of Rochester, I do know of rural communities that are doing similar work. And so I would say that while there is concentration and larger populations here in Rochester, a lot of the things can shift. One of the biggest things that I've seen across the state is rural communities taking on story walks along public trails and public access points. I have also seen our friends down in Geneva, while the town is not very rural, take on things like playful sidewalks around hubs in the community. And so, Marissa, please reach out because I have some ideas for you. The problem that we see in our rural communities obviously comes down to it's so big, right? And there aren't a lot of facilities in our rural communities, and transportation ends up being a huge problem. And so, when you think about if you're putting on an event or creating a new space or really moving forward any of this work, I would say when you're planning this out and you have, and you can work with your residents to identify this we always say that in Rochester, if we want to bring residents to the table and we want to create something that's successful, we need childcare. We need to make sure that there's food. We need to make sure that, there are things in place, right? When we do work out in our rural counties, we always say, okay, where are we holding it? How are folks getting there? How are we paying for folks to get there, right? So if it's giving them a bus pass or whatever, arranging transportation, and then how do we keep them there? And so, I would say like that's really essential to planning this stuff. But a lot of the concepts that I've shared are translatable to rural communities, but it requires a different angle because there's different barriers. Any other thoughts from folks? Cool. So I'm going to ask you one more time in the chat because our team is always ever growing. And I'm sure that there's some sort of evaluation that's going to happen with this. But because I am always all about making sure that I am effective as a presenter, I want everybody on a scale of 1 to 10. And I promise you, I will not be offended if you give me a 0. I really won't. A scale of 1 to 10, just let me know how you thought the session went. 1 being, this wasn't at all what I thought about. This was awful. Like, see ya. And 10 being like, this was great. This is what I wanted to hear today when I decided to go to that session. And like I said, as you're putting in all your numbers, really no offense if it's a 1, my contact information is there. Please reach out at any time. I'm very responsive on email. And, we're here to support you. Like I said, Common Ground Health serves the 9-county Finger Lakes region. And so if you are in the Finger Lakes region, which I imagine a lot of you are, I can support you. So reach out, please. And if I can't help you, I will ensure someone from our team can. So thanks for coming today, y'all. Really appreciated your time and appreciated you sharing this last hour with me.
Thank you, Jen.
Thanks. And I'll stick around for like the next little bit if folks have questions.